Imagine, accident and emergency closed at night. Well, soon it might be a reality as hospitals struggle with lack of staff, money shortages and increasing demands from patients. I'll be asking two medics, Lord Robert Winston and Junior Dr. Rachel Clark, how they'd make it better. Good evening. The pressure on the NHS in England has never been greater, and perhaps the most acute pressure is on accident and emergency units. As an indicator of the myriad problems at A&E, a hospital in Lincolnshire warned today it may have to close at night, saying it cannot recruit staff. More hospitals may follow. Add to that the volume of traffic at A&E as patients substitute it for their GP surgery and the rising demands of an ageing population. Can the NHS in England survive without radical surgery? The financial crisis is such that the government says NHS England must save £22 billion a year for the next 5 years. So how has the crisis come about? Here's our policy editor, Chris Cook.
The English NHS is a huge old machine which has seen plenty of trouble. Right now, though, things are rough. Short, medium and long-term forces are all running against it. An A&E may be cut back in Lincolnshire because of recruiting trouble, and a stark warning today came from a Royal College.
We are seeing deteriorating waiting times. My own hospital's actually doing reasonably well, but many trusts in the country are noticing that there are deteriorating waiting times both for elective surgery. Some patients with cancer are not getting treatment within the appropriate time, and we're seeing increasing pressure upon A&Es.
If you only look at one graph to understand the NHS in England, this is the one to look at. This first line here, this shows you the change in the amount of money that we have paid to hospitals per procedure they carry out since 2009-10. And you can see it's gone down. Something for which we would have paid hospitals £100 back in 2009-10, we now pay them about £94. And the idea of that squeeze was that it would force hospitals to become more cost effective. So what happened to the costs faced by hospitals per procedure? Well, you can see from this line, first of all, things look pretty good. But since 2011-12, hospitals simply haven't kept pace with those fallen prices. The gap between those two lines, that's the NHS's financial problem. It means that hospitals are spending more per operation than they're receiving. So to solve the NHS's financial crisis, we need to do one of two things. Either cut hospitals' costs, that means lowering that top line even further, or putting more money in, that means raising the bottom line. The short-term response to that medium-term problem has been to encourage hospitals to squeeze pay bills in particular. But that means the financial squeeze is exacerbating some long-standing problems with hospital recruitment.
We've had a history of some small and particularly rural hospitals having trouble getting doctors to come and work there, and that seems to be a problem across the public sector and in other jobs as well. The second issue is that some specialties are not as popular as we might hope. A&E is a particular example of this. It's partly a combination of the very high pressure of the job and the fact that we have frankly not trained enough and that people do not want to go into those training posts in the numbers that we need.
You can see why NHS managers have been so worried that the Brexit vote might make it harder for them to recruit abroad. Remember, the fall in sterling will be felt most keenly by people who plan their lives in other currencies. These are times that historians will pore over, not least historians of the NHS.
Chris Cook, well, let's get two medical perspectives on this now from Lord Winston, the reproductive health expert and Labour peer, and Rachel Clark, a junior doctor who's worked at A&E. Good evening to you both. Lord Winston, first of all, the financial gap is a given. Does there have to be some radical change?
Well, I think one of the first things that the government has to think about is that how has it managed to disincentivise what are the most altruistic, most well-qualified most intelligent workforces that are in the country. Since the age of 16, these people have been wanting to go into the health service, and now they're wanting to leave it early.
And wanting to go into the health service and being trained at a very high level at great cost.
At great cost, so that now, for example, one of the key issues with the A&E is that now, of course, general practitioners are wanting to leave because they are so disincentivized because of the way they've restructured the health service with the disastrous 2012 Act.
So, Rachel, as someone who worked in A&E a year ago, tell me the good things and tell me the bad things.
So before you start your first A&E job, people say to you, it's a battleground, it's a battlefield, and it is. There is blood and gore and drunks and abuse, but none of that actually makes it bad necessarily. That makes it an environment where you can strive to be the best doctor you can save lives every day. It could be everything you want as a medical career. But the brutal truth of the matter is, in every A&E rota there are gaps among the junior doctors, but there's no restriction in the number of patients coming in. So the doctors who are left are now having to do the jobs of maybe 2, maybe even more doctors, and that is unbearable. You literally may have someone in bed 1 who has just had a life-threatening heart attack, someone in bed 2 who's had a stroke, both their lives in your hands. But how can you look after them both?
But tell me, the Lincolnshire Hospital
Yeah.
is thinking of closing at night. Isn't that an unthinkable thing?
It's absolutely catastrophic. What that means is millions of people in that environment suddenly are going to be denied emergency care. They will go to other A&Es, they will swamp the other A&Es that probably also have gaps in their rotas, and the idea that this is happening up and down the country, and the Health Secretary is turning a blind eye to it. He's not being upfront about it.
Let's just turn to what you think,
Well, I don't
for
want to
example, might be done to alleviate this situation.
Well, one of the things that we should not do, of course, is to have a ridiculous argument with the junior hospital doctors over working at weekends when we're closing hospitals at night time because we can't cope. That shows the paucity of proper thinking from the Secretary of State.
But give me a radical solution.
Well, first of all, he should tell the truth about really what happens at weekends and why, in fact, the deaths that he's recording aren't related to staffing. That would be... It's very important, actually, for the health service not to be a political football. And we're in a situation where the Tory party is unopposed by a very weak opposition, and that doesn't help either.
Well, moving away and moving to you and looking at you with your medical hat on,
OK.
What do you think could be done, particularly in A&E? For example, I would say to you, it's a very unpopular thing to say, I would say to you that perhaps patients are part of the problem.
Then I think you have to go to primary care, and you have to look at actually how primary care is being delivered. And the fact of the moment is that most general practitioners are totally dissatisfied because they are running the health service as commissioners rather than looking after patients.
But what do you do in A&E? What do you do in hospitals? Do you bring in private patients? What do you do?
Well, what we could do with private practice, and I'm speaking as a member of the Labour Party, what we could do is to say we will have private practice, but we will make sure that it's actually inside the health service, so the profit goes to the health service and not to private providers who can at the moment tender outside the health service.
So wait a minute, so what you would have is you might have an A&E, and you would go to A&E, but actually, if you could afford to pay, you would go faster.
It wouldn't help A&E.
May I offer 2 other suggestions as someone who works still in A&E? One is, you have to be honest and candid about the lack of doctors, and you have to recruit more of them. Now, Jeremy Hunt and his government don't want to do that because it's expensive, it costs money. But if we don't do that, we are denying the population a safe standard of care. So that's one thing. Secondly, and this is something that your film admitted to make clear, what those statistics didn't point out is that year on year, since 2010, the share of GDP that this government spends on health has gone down. It is now 6.6%.
So we are much,
almost the lowest in Europe.
The sheer percentage of GDP is one of the lower in Europe. But let's just actually have practical solutions. How do you educate patients about going to A&E and not going to A&E for a start?
You've got to provide the primary care with the general practitioners, and if the general practitioners are not there, they will have to go to A&E. That's what's happening. That's currently what's happening.
I routinely will see patients who range from the life-threateningly sick, the ones in resuscitation on death's door, to people who come in because, and this is a real example, they've had a tummy ache for 30 years. Now, you can say, of course, that end of the extreme shouldn't be there, but if you're a worried mother who's told by a GP receptionist it'll be 3 weeks before you get your child to see a GP, what are you going to do? The crisis isn't just in A&Es, it's in general practice as well. There are 50% gaps in some GP training rotas as well as A&E rotas, so there's nowhere for the patients to go. And if the government will not be honest, will not fulfil their duty of candour with the electorate to come clean about that, then they are being dangerous and they are threatening and endangering patients.
But once before, Gordon Brown put a penny on national insurance, hypothecated it for the NHS. Is it time to hypothecate taxation for the NHS?
I don't think hypothecated taxes are the right way to do this at all, and I think very few people who work in the health service believe that's really the answer. I think what we've done is to create a structure which is really very, very unwieldy. Your film really focuses on so many different problems.
Yeah, but
that's one of the issues.
That question, let me just put that to you. The NHS is not fit for purpose. Now, it's not just to do with money, it's about the way we deliver our health care.
The way we deliver it and the way we, in fact, encourage staff to come into it, and the fact we're making it difficult to recruit staff. I mean, we don't even give work experience to young people who are considering going into the health service. That's very poorly provided for. There are all sorts of things at every level which have not been thought through in a constructive way.
Why is it impossible to have this kind of debate?
Because we've made the health service into political football, and we're not having, absolutely, as Rachel says, we're not having an honest debate. So, and until we do, that's going to be a major problem.
And so I would say one of the problems is Sir Robert Francis, who famously investigated the horrors of mid-staffs, he said junior doctors are the eyes and ears of the health service, and we see things crumbling around us at the moment, and we are packed full of solutions. We know how to do things differently. The government could listen to us. Instead, they impose policies from on high, such as the notorious 7-day NHS, and that's a disastrous way to do things.
Thank you both very much indeed.